I came from Jerusalem, the city of Jerusalem in Israel, this morning in order to bring to you the gratitude of tens of thousands of patients who owe the wellness of the heart and many times their lives to the vision of Jack Matloff. It's very difficult for Americans that have accessible care and no waiting list, usually, at least for those who can afford it. It's very difficult to understand that this situation does not prevail in every country. In Israel of the 80s, like in the UK today, patients were dying while waiting for a cardiac procedure. By cardiac procedure, I mean interventional cardiological procedure, interventional catheterization, stenting, or cardiothoracic surgery, coronary bypass, or valve replacement. And Jack wanted to change this situation. In the early 80s, he connected to Israeli medicine in general and to the medicine practiced in Jerusalem, and to be more particular, in my hospital, Shaare Zedek Medical Center, which today is the largest hospital in the city of Jerusalem, to our representative here, Shelley Lindell, who is here with us today, and he started inquiring, why is it so that in Israel people do not have the same level of cardiac care that he established here in Cedars-Sinai in Los Angeles as far as cardiothoracic surgery goes. And he learned that there were scarcity of licensed cardiothoracic departments there in Israel. There was scarcity of catheterization laboratories, and he set out to change this situation. I'm running Shaare Zedek Medical Center for 27 years, and I became acquainted with Jack when I came on board in 1988, 6 years after he started his activities, in order to establish a major comprehensive cardiac center in the city of Jerusalem in our hospital. It is amazing. Most of us physicians see as their life projects what they do in their own hospital, in their own facility. Jack, as a Jew, as a mensch, as a human being, and as a physician who brought so many accomplishments to the American cardiothoracic surgery, decided that the same standards should prevail not only in Israel, but in every country of the world. He could not see to it that this will be the situation everywhere, but he saw to it in few countries, and I think his first preference as a warm Jew was the state of Israel, and to be more particular, Shaare Zedek Medical Center in Jerusalem. He not only raised the funds, but he helped me to recruit the physicians. He put emphasis on the fact that in the multicultural, multi-ethnic Jerusalem, this is one of the fascinating things about our city, that Arabs and Jews, ultra-Orthodox Jews and secular Jews, ultra-Orthodox Arabs, Christians and Muslims live in the same city and use the same facility. And this was very important to Jack. And all through the design period of what is now the largest comprehensive heart center in the state of Israel, he saw to it that the best people will be recruited to run it. He helped us to design the space, and when he attended with you, Martha, with Lori, and with Stephen in May 1994, over 21 years ago, the opening of this facility, there was no one more excited and more moved than Jack Matloff. When we decided to name the Department of Cardiothoracic Surgery after his parents, Ruth and Hyman Matloff, Jack, who was usually, with all his formidable appearance, both outside and internally, he cried like a baby in that inauguration ceremony. And since then, a special bond was created between us. I had no hesitance to take the long flight from Tel Aviv and to come here this morning to pay tribute to a man who changed the lives of thousands and tens of thousands of Israelis, who changed the face of cardiac care in the state of Israel as he did in many other countries, setting the same standards that he set starting in 1969 in this city of full transparency of data, because Jack loved data and wanted always transparency, to know everything. He knew by name every surgeon and every cardiologist. He discussed with me whether we should take a new faculty, this guy or the other guy. He was calling me time and again to discuss the affiliation of the hospital with the Hebrew University Medical School, because academics was important for him as much as clinical medicine. We usually say that we would like to see in a physician in a senior physician, 5 major skills. When I select from my hospital a new head of department, I would like him to be 10 out of 10, first and foremost in Menschlichkeit, then in managerial skills, then in the discipline of the department that he is running, then as a researcher, and then as a teacher. Jack was the only man that I knew in my long career who abided by the 5 criteria and got 10 out of 10 in all of them. His Menschlichkeit was discussed today, but I realized it almost on a weekly basis when he spoke over the phone, and what interested to him was the well-being of the patient. He called me 17 years ago and said there is a Palestinian doctor who is finishing his fellowship in Philadelphia in thoracic surgery. His name is Maher Dib. Please recruit him. And I interviewed Dr. Maher Dib, who wrote a letter to the family this morning, an email mentioning how Jack changed his life. I interviewed him and recruited him as the head of the thoracic unit of the Cardiothoracic Center at Shaare Zedek. 10 years later, during the Intifada, a young American girl who spent a year in Jerusalem and was wounded by a terrorist act in Machane Yehuda market, which is a central place in Jerusalem, and came actually clinically dead from bleeding from her lung to the doorstep of the hospital. She was rushed to the operation theater and operated on by the same Dr. Maher Dib, the Palestinian. This is the surreal reality in the city of Jerusalem, and her life was saved. She came to celebrate with us the birth of her first child. So that was the vision of Dr. Matloff, a great clinician, a great surgeon, a great mensch, a great researcher, and a great teacher. We will remember him forever, and we will miss him back in Jerusalem on a daily basis.